Hi, I'm here to discuss the new advances in AML therapy at the ASCO 2018 meeting. There's a couple things that are really exciting and are making us even more hopeful that after the approval of 4 new drugs for AML, that there may be more drug approvals coming very, very shortly. And this is just such a windfall for us after 40 years of not having any improvement in the standard of care. The two things I'm most excited about are the development of now IDH1 inhibitors as well as IDH2 inhibitors. Dan Palia at this meeting is presenting an oral abstract with the results of a phase 1 trial of ivosidenib, which is a potent oral IDH1 inhibitor, in 179 patients with refractory relapse to AML receiving a dose of 500 milligrams and above. His study shows data which is very similar to the data that we saw with enasidenib in IDH2 mutant AML, specifically overall response rates about 40%, again complete remission rates of about 24%, CRI rates about 10%, and stable disease again seen in 36% of patients. Looking at that data, the drug was once again very well tolerated, and there was an incidence of differentiation syndrome and QTc prolongation, but overall it is very, very hopeful that given the similarity in the outcomes between the IDH inhibitor and its companion IDH2 that was already approved, that we may be seeing ivosidenib approved for the treatment of IDH mutant patients in the very near future. The other topic that I'm very excited about is some additional data looking at the BCL2 inhibitor venetoclax alone and in combination monotherapy for patients with newly diagnosed and refractory relapsed as well as elderly AML patients. The BCL2 inhibitor has kind of taken the AML field by storm. We all are familiar with its use in CLL, and increasingly more and more of us are adding it to the standard hypomethylating agents for elderly AML patients newly diagnosed. And this is just more data supporting the use and safety and the ability of that oral BCL2 inhibitor to induce responses. So overall, I'm very excited, and I'm looking forward to seeing these 2 drugs moving forward into our armamentarium formally in the next 6 to 12 months.